Did you know that the mouthwash you use to get rid of bad breath could be the actual cause of your bad breath? How is that? Many mouthwashes, especially those with alcohol or that are highly antibacterial, don't distinguish between the good and bad bacteria in your mouth. So instead of caring for your mouth, you're creating a battlefield in there where you're destroying both the good and the bad bacteria. The problem is that the bad ones survive better than the good ones, and the balance is lost. And many of the bad ones are the ones with those sulfur compounds that cause bad breath. And the worst part is that some people use it up to 3 times a day after brushing, and that's definitely causing dysbiosis in your mouth. And if we add that many mouthwashes, due to their ingredients can cause what's called xerostomia or dry mouth, it gets even worse because a dry mouth will always smell worse. Normally, bad breath isn't going to go away with mouthwash. What does mouthwash actually do? It's going to mask that odor coming from your gums, your stomach, the plaque you have, or even the bad breath from tonsil stones coming from your tonsils. I'm a dentist and I don't use mouthwash. I use water to rinse, nothing else. And it's always recommended to rinse before brushing. Why? So that all the large food particles are gone and don't stay on your toothbrush. Brush your teeth, use your dental floss, and then rinse again. Why? To remove all that leftover toothpaste, which unfortunately can irritate your mucosa and cause damage to your throat, like irritation, which can later be reflected in sleep apnea. Even, as you know, there are toothpastes with ingredients that can cause canker sores. Therefore, we have to be careful with all the chemicals we put in our mouths. And what I'm telling you obviously doesn't happen with all toothpaste or with all patients. The vast majority don't have any kind of allergic reaction or inflammation, but many people do. So you should use alternatives that don't have these chemicals so they don't cause that irritation. Now, if you have bad breath, what can you do? The first thing is go to the dentist. They need to do an x-ray study to make sure you don't have cavities between your teeth, interdental cavities. You have to check that you don't have plaque buildup between your teeth or right down here, which is where tartar most often forms. Of course, flossing is very important to remove those food particles that then stay between your teeth for 3 or 4 days. And what does it smell like? Well, you can imagine. We also have to check our tonsils to see if we have crypts that generate tonsil stones, which can smell terrible. And of course, also rule out an H. pylori infection that could be in the esophagus, causing bad breath. And of course, don't rule out digestion and obviously what we eat, since we smell like what we eat. There are also habits like mouth breathing, drinking alcohol, or smoking. That doesn't help your bad breath at all. So if you need to use a mouthwash to get rid of bad breath, what you really need is to go to the dentist and have them check everything I mentioned, because that's likely where the problem is. It's time to attack the problem at its source and not mask it with mint flavored